चलिए, let's come to this particular topic. We had very lovely quiz on this, very detailed quiz. Then there had been 2 master classes on this. And you must be wondering why this particular session. It's very clear. The organizers feel the people must be updated again. They should have a confidence why MHT, menopausal hormone therapy, should be revived. And many people who need it should not suffer in silence. As far as osteoporosis is concerned in this country, beyond 65 years is almost 100%. Many other problems are there. So I think we are going to take one by one. I'm going to make it simple. By my phone focus will be on MHT. Toby had been the past president of International Menopause Society. This gentleman is in Africa, South Africa, and he said, all menopausal therapy regimes are not the same. So जो हमारे दिमाग में बैठ गया है कि they are harmful, they should be revisited again. We all know about and we are very familiar with these symptoms. या तो हमने खुद भुगता है या हमारे पेशेंट्स ने हमको याद दिलाया इनके बारे में. As far as I am concerned, I felt my knee joints bothered me once I got menopause. I also noted जहां पर बाल होने चाहिए वहां तो है नहीं और जहां नहीं होने चाहिए वहां आते. Forgetfulness, I didn't have so much time, but yes, I found some time. I have patients admitted here and there, and I will be in the morning blank.
Universal phenomenon.
I come quietly to my clinic, and they ring me up, Doctor Sahab, आप तो आए नहीं आज देखने मरीज को. Then you suddenly realize. And then I definitely had some bladder problems also during this particular time. I was never suffering with hot flushes and things like that. That never happened to me. But that's a reality. You can see here that right at 40 plus, the vasomotor symptoms are the first to knock you out. You have mood changes. Some people find sleep changes as well. Menstrual disorders, I will say, is a welcome change. Here I wish to realize to all of you that in 3 ways the menopause sets in. I was having regular periods and suddenly stops without any change. The second category is I am having monthly periods, but over a period of time I've realized that the flow is scanty. But the most common one is that your periods get delayed, and every time when you have your period will be lossless. Period kabhi heavy hoke band nahi hote. Whenever your patient has heavy period, there is organic pathology. So never ever take a side when your patient says, "Hamare menopause ka time aa gaya." No. Heavy hoke menopause kabhi nahi band hote. Then urogenital atrophy and dyspareunia definitely bother people. And that's one of the main reasons to bring you to the doctors. Osteoporosis, things related to cardiovascular diseases and all come late. आपकी जो फैमिली में हिस्ट्री है आपको जरूर होगी. नो एस्केप. आपकी जो माता पिता को हो आपको होगा. Now this history is, I think I'm going to repeat it third time. The hormone therapy came in 50s, 40, 50s. And then everybody used to take it to remain ever young. Of the top 5 prescriptions in the world, it was one of them. Top 5 prescriptions in the world. And then when I was doing MD, in 72, the report came that this estrogen, on one side it brings a pink cheeks for you, on the other side it is associated with endometrial cancers. And then from there the story started of using of progestogens along with estrogens. And then still it was very popular. But then came the VHI study. And VHI, I once wish to repeat here, in US, the National Health sent letters to every male, to every doctor, not only gynecologist, every doctor. And every woman who was more than 40 years, the letter had gone, showing that this has problems. So the story will never be the same. It will never be the same. And naturally you can see, very gracefully they have written down that it has come down to, prescription came to 1/3, but I think it's much, much, much less than this. As far as we Indians are concerned, we are strong, 1.3 billion today, and the survival expectancy is around 71 years. The global age of menopause is 51 years. As far as we are concerned, ICMR said it is 49 years, a large study, pan-India. And then Unni, who had been a social scientist, said it is 47.5. And then came the study of Indian Menopause Society. Our friend, Dr. Ahuja, had done this. And she said it's 46.2. Here I wish to tell you, as for the premature menopause is concerned, the global incidence is 1%. But as far as we are concerned, the incidence of menopause setting prior to 40 years, which is set premature menopause, varies from 1.5 to 20%. The people who are infertility and IVF expert know it. That ovarian aging occurs 6 to 7 years earlier in Indian women. Chinese are the worst. We are close to them, but it's definite phenomenon, and that's why I'm not surprised when I found that the incidence of almost 20% from coming from few centers saying that a premature menopause occurs. Whatever is the consequence is all because of the estrogen deficiency on the metabolism. And once the estrogen protective effect is not there, these people have an increased risk of cardiovascular diseases, and this group is especially prone to diabetes, prediabetes, and metabolic syndrome. It is said that women who have less than 30 years of reproductive life have almost 40 to 50% increase in this cardiovascular problem in comparison to people who have had reproductive lifespan of 36 to 40 years. Now this is WHI lessons. You find there was an increase. The very premise that it is going to protect you from cardiovascular problems, it is going to protect you from breast cancer, it is going to protect you from thromboembolism. The very things increased, and that's why the study was prematurely stopped. Now, what is the message? After this, the message has gone to medical fraternity that there is definitely alleviation of vasomotor symptoms, that is hot flushes. There's improvement of vulvovaginal atrophy and the recurrent urinary tract infections which occur during this particular time. And the fracture protection is also there. But the risk outweigh the benefits. As far as the cardiovascular risk is concerned, risk of thromboembolic diseases, risk of breast cancer, risk of death. Here I wish to just tell you, breast cancer is very, very little. Hardly. I'll dilate it later. And during this particular time, the term was changed to HRT. From HRT, it has changed to MHT. It was also went in people's mind that the progestogen component is a class effect of all MHT. Other lessons also which we got from WHI was that the beneficial effect of MHT on cardiovascular disease is only evident when it is started prior to 60 years or first 10 years after the menopause. And all-cause mortality is not raised in patients with MHT. That should also go away from our mind. Tobey said that the addition of medroxyprogesterone acetate to conjugated estrogens, that is estrogen, in patients with intact uterus is attenuated the beneficial effect seen with estrogen alone as far as the cardiovascular problems are concerned. There is no doubt that the arm which only had estrogens, it means the uterus was out. In this, the beneficial effect was seen on the breast cancer, beneficial effect was seen in cardiovascular problems. But the moment you added progestogens, all this beneficial effect went away. So I repeat again, MPA added to estrogen in patients with intact uterus attenuated the beneficial effect seen with estrogen alone as for the cardiovascular disease is concerned. He also highlighted the risk of breast cancer is lowered with estrogen alone compared with estrogen and progesterone combination. These two things are very, very important. Now, 15 years after WHI study, the person who was the chief investigator from the Harvard Medical School and said, and the Tobey also opined, that the big concern in clinical practice is not the overuse of hormone therapy for prevention of chronic condition, it is the underutilization and undertreatment of women who have the problems, who have menopausal symptoms. So let's recap. If the uterus is out, you can use estrogen alone. And you can use this on a continuous basis, so there will not be any bleeding. If the uterus is intact, you can give it in two ways. You can give it sequentially, that first estrogen, and then you add on progestogens, and then you give a break of 7 days. And during this particular time, there will be regular bleeding at the end of the cycle. Or you can give continuous sequential HRT without any gap. But specific time, in initial part there is only estrogen, in the second half there is estrogen and progesterone, then also you will have regular bleeding. Then there is another continuous combined HRT where you give estrogen and progesterone again and give it on a continuous basis, because the medication is the same 30 days, 365 days the same. There is no withdrawal bleeding here. Is everybody is clear on this? Any doubt? Now a big question. Does the estrogen matters? compared to estradiol, certain estrogen in combined equine estrogens are more resistant to metabolism, and the medication shows relatively increased effects in certain parts of body like liver, and at the same time we find there's an increased risk of blood clots and a cardiovascular disease with conjugated estrogens. And that explains why WHI study had all those side effects. When it comes to vasomotor symptoms, except menopausal hormone therapy, it is the only thing which is effective. Rest are garbage. It doesn't affect. Only thing which affect is MHT. Clear? The risk of stroke is associated with route and dose of administration. Now here I wish to tell you, anything on the right side is favorable. Anything on the left side is unfavorable. And anything is on this line is okay. This is the way we interpret studies. And this said that any of things which you use, low dose, transdermal HRT or MHT did not appear to increase the stroke risk. Rest, low dose, high dose is going to affect. So if you have to take, it has to be in patches or it has to be local. Now as far as the protection of endometrium was concerned, you can see here when it was alone, the simple hyperplasia was 28%, complex hyperplasia was 23%, atypia was in 12%. But when progestogen was added to estrogen, this became 0, 0, 0. So there's no doubt when you add progestogens, there is a protection of the endometrium for hyperplasia and malignancy. Now, alternative in today's time, I'm talking today's time, alternative to adding progestogen is Tibolone, a product metabolized to estrogen, progestogen and testosterone. It is good. Another newer combination which we have not seen is conjugated estrogen combined with benzodoxifene, and this also is good. And then levonorgestrel marina is effective. Now what can be the alternative? These are the long list of progestogens which have been added on with estrogens, and here I just wish to tell you all progestogens are not the same. They are all plant source. One process is micronized progesterone. The market is flooded with micronized progesterone. All of you know about it. And another one is light technology bends them, and then you have what is called dihydrogesterone. Clear? The other day, Dr. Jyoti elaborated to you how overnight you change your mind, how you treat threatened abortion. The same is true with ART. And now, this particular molecule, dihydrogesterone, is used in America for a very long time. When I prescribed my daughter during pregnancy that you should take Dufaston. She said, "Mom, nobody uses here in pregnancy. This preparation is only used for menopausal patients, even with estrogens." So this has a long history. And that particular preparation is brought by Abbott here, which has been used there. Now, I wish to emphasize again the experts who had been heading the International Menopause Society. They say the culprit is MPA, medroxyprogesterone acetate. First we thought it is a hero, but it is a zero. All the problems are related to metabolites of this particular hormone. There is a general consensus today that the poor cardiovascular and the best result when you see, which are seen in estrogen progesterone arm of WHI, were not a class effect of progestogens all. It was class effect of only MPA. It is the result of specific metabolic effect of MPA. Coming to the breast cancer. कोई कैंसर का नाम लो, डॉक्टर्स लोग नहीं लिखेंगे, चाहे कितना भी स्मॉल हो. You can see here, this is the baseline without any MHT. Here it shows, this is the combination which I'm talking about. This combination is very close to this, 1.1. While you can see here it is 1.64, and in these much more than that. So the risk elevation may not be uniform for all progestogens. Now as far as venous thromboembolism is concerned with different progestogens, you can see here all which have been used. The micronized progesterone and pregnane derivative appear to have acceptable thrombotic risk profile. So there has been an update in 2013, and it said that the progestogens are not alike with regard to potential adverse metabolic effect, cognitive effects, or associated breast cancer risk when combined with systemic estrogen therapy. So they are not the same. Now what is the combination I'm just talking about? Estrogen and dydrogesterone. This formulation, which has been approved in India, is for continuous sequential therapy. It means 17 beta estradiol is 1 milligram and 10 milligram is dydrogesterone. This is for sequential. But if we want to use it for combined continuous, then it is estrogen is the same one, but progestogen is 5 milligram. And here you can use a continuously, there will not be any bleeding. When you use sequentially, it is the bleeding will be there at the end of it. Now, as for the benefit and risk profile of MHT is concerned and vasomotor symptoms are concerned, that's our focus. The MHT, including tibolone and the combination of conjugated equine estrogen with benzodoxifene, which I just now mentioned, are the most effective treatments for vasomotor symptoms associated with menopause at any age, but the benefits are more likely to outweigh the risk if initiated for symptomatic woman before the age of 60 years. So अगर आपको इसको use करना है, you should use in the golden window of opportunity, that is first 10 years. Now as far as this estrogen and dydrogesterone is concerned, 1 is estrogen, 5 is progestogen, improves hot flushes compared to the placebo.
When is it available in India?
अरे बताओ नाम, मैडम नाम बताओ, लाओ लेके आओ ना अपना. नहीं ये हमारे यहाँ भी बिल नहीं, नहीं ये नीचे वाला. मैडम सबको दीजिए. This improves hot flushes compared to placebo. No, this tibolone is available. Significant reduction in moderate to severe hot flushes versus placebo is seen. You can see here again on various scale it has been found out and results are the same. As far as the BMD is concerned, sequential, this combination effective versus placebo in preventing loss of bone mass in lumbar spine and femoral neck over 2 years. This shows this continuous use significantly increased lumbar vertebrae and hip BMD. As far as vulvovaginal atrophy is concerned and genitourinary syndrome of menopause is concerned, where the ladies are really bothered about, again, Tibolone is effective treatment of vulvovaginal atrophy and GSM. The sequential OCP using this particular combination in the dose of estrogen 2 mg and dydrogesterone 10 mg is reduce the menopausal symptoms. The benefit risk profile of MHT as for the cardiovascular system is concerned, the randomized clinical trial and observational data as well as meta-analysis provided initiated in younger women less than 60 years or within 10 years of menopause show a less compelling trend to mortality benefit, and evidence on cardio protection is less robust with inconsistent results compared to the estrogen alone group. So whenever the estrogens are used, you find the benefit is there. The progesterone, however good it may be used, probably it will not have that great effect. As for the sequential preparation using this combination, effect on lipid profile, effect on diabetes, effect on hypertension, effect on cardiovascular events shows a positive results. As for the breast cancer is concerned, I showed you the slide earlier, the breast cancer risk with this combination, dydrogesterone, similar to non-users of MHT. So, in the profile of WHI, all this risk which had been highlighted, the word is should be used for a lowest dose at the shortest possible time. So to summarize, as far as the menopausal hormone therapy is concerned, individualization is the key. As for the dose, the type, the route is concerned according to the need of individual woman. When hysterectomy is done, you can use estrogen alone. When the uterus is intact, progesterone is must to be added to estrogens. The art of prescribing MHT is to use the minimum effective dose judiciously, and that too on indications. किसी को मेनोपॉज हो गया, कोई symptoms नहीं देने की जरूरत नहीं है. It has to be, indication has to be there, and that too after a proper counseling. The counseling is a main component. The specific indication for starting HT must be present and must be documented. The symptoms which definitely require HT are vasomotor symptoms and the symptoms as a result of urogenital atrophy. The main rule for giving HT is to use lowest possible dose for the shortest possible time. I'm repeating it third time. For prevention of osteoporosis, there are other modalities like bisphosphonates are the drug of first choice. When those cannot be used, this can be used. I repeat again, for osteoporosis prevention, HT takes back seat. It is effective, but there are better alternatives are available. Assessment of risk factor prior to starting HT is essential prerequisite. You make the total assessment of that particular patient, what all she has. The lifestyle modification is an integral component of managing post-menopausal women. Coming to non-pharmacological preparations. The soya isoflavones are very popular, but the effect is zero. The same is black cohosh, very popular, but the effect is zero. आपसे पूछते हैं, आप कहते हैं कि जी हार्मोन्स की सोच लो भाई, तो डॉक्टर साहब कुछ तो दोगे, आप लिखते हो 3 महीने लेने की बात बोलते हैं डॉक्टर साहब थैंक यू वेरी मच, इट्स नॉट इफेक्टिव. Am I clear? Is as great as this. So you have to, at the beginning itself, you have to say that if you don't want to use MHT, lifestyle changes do yoga, do meditation, get involved in social service, keep yourself busy. In 24 hours, you should 48 hours work schedule. You will not have symptoms. Additionally, black cohosh is known to, it has had on a package, it has the warning statement is there that it causes liver diseases. So you have to think about it if you wish to use it. So coming to the last slide. This Indian woman is asking you, if you think it's a universal invent, then say so. Why treat? If you think the protective effect of estrogen matters, make up your mind. Give me the MHT, which is proven safe MHT, which works just like calcium and any other antioxidant or aspirin. And when I take it, I should be able to say, I'm feeling so much more like my old self. So with these words, thank you very much.